Good afternoon. I'm Joy Marini with Johnson & Johnson, and I'm Director at Corporate Contributions for Maternal and Child Health. So basically my job has been to attend all of those conferences and meetings that SMETA listed this year. I just want to make one clarification before I start, and that is that for Johnson & Johnson, Corporate Contributions is a purely philanthropic arm of J&J. So we are not a social business. We are not a, so I was interested in hearing about what is the business interest, because actually for J&J frequently there is not a business interest. It is set aside by our credo as our responsibility to the communities in which we live and work. So we might be a little bit of an outlier. I actually find frequently on a panel we are an outlier because we are strictly philanthropic. So our mission is to make life-changing long-term differences in human health. And we do that through partnerships. So we have over 600 partnerships in over 50 countries. And it's an interesting model that we use, one that we're often praised for or criticized for, in that we have partnerships that are as small as a tiny little NGO in Sierra Leone. Maybe it's a $5,000 grant. We're helping them to find a board that isn't made up of their cousins and their brothers. We're trying to help them with monitoring and evaluation, helping them to build capacity of their own small organization. And then we have partnerships with UN agencies, NGOs, directly with ministries of health, ministries of education, professional societies and universities. So we really run the gamut. And you know, we're often asked, why are you even bothering with these small, tiny, nascent organizations? But I think we have a lot of passion for that, and that's where we see a lot of innovation happening that then we can take into other partnerships. So I was happy to see that we've learned some of the same things. So what have we learned on the corporate side? The first is that partnering is a give or take process. It is, the first year is often the most painful. Anybody here starting a new job this year and trying to figure out, you know, what is expected, what are you supposed to be doing, what's going to work? Partnerships are the exact same way, and we often find that if we can get through the first year and start getting a little traction and build a little trust, that we really have exponential growth in the following years. Partnership requires communication. We cannot work in silos as we have in the past, and in fact, there are many, for instance, the Helping Babies Breathe, the Global Development Alliance, has came together around March, I guess it's sometime earlier this year. There are several other large global development alliances that have been created, and we from the corporate side are finding that while it is absolutely the right thing to do, it's not that easy to work with these big global development alliances. While they come together and they find like objectives, often they haven't figured out how to reach those objectives in a true partnership. So they have a Global Development Alliance, and they're still working in their own silos. And one of these examples is with one of these Global Development Alliances, I have had to contact 4 different partners, and literally none of them knew that I'd contacted the others until I told them. So partnerships require communication, and this is something that we all have a passion for. We all, and by we, I mean both civil society, government organizations, private sector, we all feel that it's the right thing to do, but we're still learning. So we're still trying to figure it out. But I will tell you from the private sector side, it's a little bit frustrating, especially when we really want to partner, but we don't want to partner in the old way. We're looking to partner in the new way that these global development alliances have outlined, but they're still learning. And partnership yields very rich results if the partners can trust and leverage each other's strengths, and Wendy referred to that. And I wanted to talk a little bit about the strengths that a corporate partner can bring. So everyone in the room probably said funding. Okay, come on, let's be honest. How many people, by a nod of the head, thought funding? Yeah, that's true, funding. I will say at J&J that while out of our 600 partnerships, the majority of them have some funding mechanism involved, some of those partnerships are strictly collaboration or consultation. So for instance, some of our partnerships, perhaps we didn't have at that time a focus on that area or budget available for that particular partner, and perhaps they asked us to come in and just help them with their M&E or help them with their communications. And we have always been very open to that. Our whole team, there are about 24 of us, are very collaborative and very willing to work as consultants with partners, even when there's no funding available. And to be listed as a partner, which sometimes creates a rainmaker effect, particularly for these smaller organizations. Leveraging business assets, as Wendy said, we obviously have a variety of health products, and we have relationships that we bring in. And for instance, our leadership and management training. We worked with the American Academy of Pediatrics about 10 years ago on a leadership and management training, and that completely revolutionized the way the Academy worked. This training was done within their own leadership, and they are now teaching it and have been teaching it for years to other organizations as well as throughout their own organizations and with their volunteers. Other business assets, the mobile phone technology. We are in fact the original funders and supporters of the Text for Baby that Wendy mentioned, and we'll probably be moving into a sole funding support in the next year. I don't know if you're aware of that, it's in discussion. But also, we, Johnson & Johnson owns the website, it just went out of my head. Baby Center. I'm sorry, Johnson & Johnson owns Baby Center. Baby Center provided a lot of the messaging on Text for Baby for these mothers. So we had both the funding and we also had a technical expertise to contribute. Innovation. So this is for a partner. Something that I think is very difficult, particularly, and you have to understand your corporate partner. This is a quality that's rewarded in the private sector, but it's often considered a little bit too risky. There are always surprises, good surprises and not so good surprises. Some things don't work out. But at J&J we understand that, and we have a very high tolerance for innovation and maybe even for failure in some of our partnerships. Because if you're not doing anything, you're never going to fail. A drive for results. So another strength that corporate partners have is that we are always driving for results. We are expected to turn in business results, and even in our philanthropic arm, we are expected to show impact. So not just outputs, but also outcomes. Did behavior change? But now when I say that, you have to think, how do we work with government agencies? What does that mean? How does that affect that? So outputs on the ground, we get it. You know, how many people did you reach? How many? But without the infrastructure, it's very difficult to have some of the outcomes that you're looking for. Government partners are often looking for large sustainable change. They are looking at mortality rates. They're looking at things that take years to change. And we need that also. And we cannot do that without government partners. So in order to make those changes, we have to reach out often to those who are doing advocacy work as well. So I'll give you an example. We worked on, well, for 10 or 15 years, they were doing neonatal resuscitation training. The American Academy of Pediatrics, several of the NGOs were doing this work in China. And they'd train a few people in a little area, and then as those people moved on, there wouldn't be anybody trained. It wasn't a requirement by the medical societies or by the government. It wasn't a requirement for labor and delivery. And 5 years ago, we launched the China Neonatal Resuscitation Program called Freedom of Breath, Fountain of Life. And in that time, we had a government partner. We also had some support from UNICEF and WHO, as well as the medical and nursing societies in China, and we began to see change. So the first year, the tough year, we were doing some training, we were training some national trainers. Year 2 comes along, and suddenly there's this realization that nurses, it's not within a nurse's scope of practice to resuscitate an infant. So who's at the bedside? Who's at the bedside when you have a baby? Usually it's a nurse or a midwife, maybe an OB. And government came in and changed the policy. Year 3 goes by, now we're training more and more nurses and midwives, as well as physicians and anesthesiologists. Year 4 comes by. We need to change the policy again. This needs to be required in labor and delivery. So this now becomes a certification that everyone working in labor and delivery has to have. So all throughout the process, and then all of a sudden there was a realization we need to have a better system for monitoring infant mortality. How are we monitoring? How are we recording this? What is the neonatal audit? So our government partners really made huge sweeping policy changes that gave us the infrastructure that as we continue to train and set up provincial trainers and hospital training teams, we have now the infrastructure to make this sustainable and to continue to train the rest of the country. So there are a lot of things that the private sector brings to partnerships, but we really cannot do it without government partners, without NGOs, without scientists, without health organizations all coming together. So I really encourage those of you who are working in this arena to take this message very seriously. We cannot continue to work the way we used to with partnerships that were just in name. We really need something that's more robust, and I think we're all working toward that now. Thank you.